So if you have ever been in a clinical room, that someone who is having bipolar affective disorder, that at one point you see them very happy, they are enjoying, they are laughing, I am the president of Uganda, then the next time they are saying, they are crying. In today's video, I want to show you what antidepressants should be avoided in people with bipolar affective disorder. If you're a student, if you are a medical worker, and also you are a patient who is in the community and swallowing medicines of bipolar affective disorder, this video is good for you. So watch until the end. And if you are still new to this channel, I request you to subscribe. Okay? So one of the reasons that we have is that antidepressants have a risk of switching someone from depressive mood to mania. Okay? So we know very well in mania that someone comes talking a lot of things, someone is aggressive, someone is irritable, someone is fighting, and this is a psychiatric emergency. Okay? So we are saying that these medicines, if they are used in someone who is having bipolar affective disorder, is that they have a high risk of switching someone from depressive episode to mania. So we don't advise you as a health worker or you as a medical student to use antidepressant as a monotherapy. Okay? Monotherapy means using one drug to treat a condition. Okay? Number 2, we are saying that rapid cycling and destabilization. Okay? According to different research shows that antidepressants have a high risk of accelerating cycles in terms of mood. Okay? So we see very well that we have two types of bipolar affective disorder. Is that we have bipolar 1, or which is called manic phase, okay, where someone comes with grandiose and talking good about themselves. I am the president of Uganda, I'm the president of America, I have a big hotel in Kenya which no one else has in the world. So that is bipolar 1. Okay? But in bipolar 2, someone comes with symptoms of depression. Okay? So we are saying that these drugs can accelerate the risk at which this cycle can occur. Okay? So if you have ever been in a clinical room, that someone who is having bipolar affective disorder, that at one point you see them very happy, they are enjoying, they are laughing, I am the president of Uganda, then the next time they are saying, they are crying. So when we give this antidepressant, is that those cycles, they can be accelerated so fast. Okay, that's why we are saying that they need to be avoided as a monotherapy. According to research, they are saying that rapid cycles are associated with more severe form of mania or of severe illness. Okay, if you are still new to the channel, I request you to subscribe, because this motivates me to make more content for you. And people from South Africa, people from UK, people from Uganda, people from Kenya, thank you so much for watching my videos wherever you are in the world. Let us share this information so that people may get the information and we may have a well mental health community, or to have a community with a sound mind. So reason number 3 why antidepressants should be avoided in people with bipolar affective disorder is that there is what we call induction of mixed states. Okay? We are saying that these people can come when they are having either manic phase or depressive phase. So we are saying that when we use antidepressants as monotherapy, people can come when they are having depressive and manic phase occurring simultaneously. So that's why we are saying that if it is possible, antidepressants should be avoided as a monotherapy, in that these ones are associated with agitation, irritability, okay, aggressiveness, in that if a manic patient is aggressive, it will require hospitalization. We need to admit this person in a hospital setting. So remember, when you admit someone in a hospital setting, it is going to incur costs. It is going to go deep into someone's pocket to pay the medical bills. Okay? So if we are managing patients out there, we should be careful in that we can help people to save money in terms of paying medical bills for their people. Reason number 4 why we should avoid antidepressants in people with bipolar affective disorder as a monotherapy is that lack of strong evidence for benefit. So according to research that antidepressants when used in patients with bipolar affective disorder is that on average traditional antidepressants show no more superiority over mood stabilizers or antipsychotics. In summary, we are saying that on average antidepressants do not show a clear superiority over mood stabilizers or antipsychotics. Okay, so when we give someone antidepressant, in that we are saying that the evidence in improving the patient's condition is very little. Okay, compared to mood stabilizers and what? Antipsychotics. So clinical guidelines from major organizations strongly recommend that if you're having a person who is having bipolar affective disorder, that you can use mood stabilizers and antipsychotics, and that is specifically atypical antipsychotics as the first line treatment for someone who is having bipolar affective disorder. So this organization recommend against using antidepressants as a monotherapy in people who are having bipolar affective disorder. So we are looking at reason number 5, which is the last reason, is that we are saying that the reason why antidepressants should be avoided in bipolar affective disorder as a monotherapy is that the concern is so much in bipolar 1, that is where someone comes with manic phase, or comes in mania where someone is aggressive, someone is fighting. Okay, so the concern is so much in that bipolar 1. Okay, but also in bipolar 2, it is not advised for us to use antidepressants as a monotherapy. Okay, remember, bipolar 2 someone comes when he is in depressive phase. According to research, what shows that when you are managing someone with bipolar affective disorder is that the first line treatment is that you have to use antipsychotics, and that is atypical antipsychotics, and also you have to add mood stabilizers. Okay, so if someone is coming in bipolar 2 where is having depressive symptoms, is that you can prescribe your antidepressants, but ensure that you have mood stabilizers are there, antipsychotics are there. So if you're a medical student out there, we are saying that if someone comes and having bipolar affective disorder, but this time is in the depressive phase, okay, you give your antipsychotics, you give your mood stabilizers, then you put antidepressants. Okay, so thank you so much for watching my video wherever you are. If you found this helpful, please subscribe to my YouTube channel and share with other people so that also they can get this information. Thank you so much.